And now for a patient's perspective. We're joined virtually by Vanue LaCour. Van, thank you so much for sitting down with me today. You've had quite a journey with cancer, so take me through it. When were you first diagnosed with prostate cancer, and what did treatment look like for you early on?
I was diagnosed with prostate cancer back in November of 2007. I had gone to my urologist for a checkup. And when he checked, he found that my prostate was swollen, and which gave him great concern. And he wanted to do a biopsy, did a biopsy. Sure enough, it came back positive for cancer. Biggest problem, it was swollen. It was close to the outer wall of the prostate. And his concern was it could erupt and go to other areas of the body. So the decision was made to do the prostatectomy and do the surgery and remove it, and lessen the chances of the cancer spreading and what have you. Well, after the surgery, he determined that I was cancer-free. And 8 years later, the cancer reappeared. And we went through series of doing the chemo and some oral tablets and what have you. Got to the point, the PSA was coming down, got under 100, but it got like around 60 and bounced back and forth between 60 and 90. And so the decision was made to refer me to another facility. I went to MD Anderson.
Now, when did your treatment change to Plavicto? And what did your oncologist say about why your treatment was changing?
Cancer came back in 2015. In 2018, I started at Tulane Cancer Center. So we went different. While I was in the trial, we were using different oral medications and of course monitoring and doing scans and all that, and watching the progress of the cancer. And at the same time, he was running the clinical trials with this medicine. Then the name was called lutetium. And the trials were proving to be very, very successful. This lutetium is the medicine that uses nuclear elements. My study was also pretty much coming to a conclusion, because at the same time what they were doing is monitoring my progress. And he was interested in getting that PSA down much slower. So he invited me and asked me if I would be willing to take the lutetium medicine. Had not been approved yet by FDA, and that's what they were working on, getting it approved. And of course I said, sure. And immediately we started a program. It was like a 8-month program, 6 treatments, and they started me on the nuclear injections. And I go back every 6 weeks and get the injection. And each time the results saw the PSA drop like at 10-point increments until I got down to the final one, and it was finally under 10, down to 6. And it hadn't been there in a long time. And right now it's still hovering around 6. It's not completely gone, so I'm still being monitored. But the new medicine known as Plavicto is now on the market. It has been approved by FDA. And I certainly am high on it. It improved my situation. I have all the confidence in the world. I'm going to live longer. And that was the main objective, is to make sure I continue, stay alive.
Wow, what an incredible journey. How does it feel now after all these years since that original diagnosis?
Pretty good, very, very good, because I'm alive and I'm able to do things. I'm a little slower. I'm also 80, but I feel good now. I'm back to doing a few things I can't do as much as I used to, and a lot of that got probably to do with my age, but it's summertime here, so I'm back to doing yard work, and I'm good.
Van, thank you so much for sharing this with me. All the best to you.